think everyone is here. Thank you all for joining us this Happy Earth Day. Thank you all. Caring in Crisis, Pet First Aid Essentials, and Human First Aid Essentials. We want to thank both of our speakers, Dr. Becky DeBolt, a doctor of veterinary medicine, and Dr. Jason French, human medicine. Candace, you got everything going?
Yep. So I just want to thank you all for attending today. Thank you to Dr. Becky and Dr. Jason for joining us. We had put some questions out on the One Health forum to see what people were interested in and how things they would like to learn. So today, as T said, we have Dr. Becky join us. Dr. Becky earned her DVM at North Carolina State University and has spent most of her career in shelter medicine. Dr. Becky is currently a clinical associate professor of shelter medicine at the University of Tennessee College of Veterinary Medicine, where she enjoys bringing the field of shelter medicine and veterinary students while simultaneously helping shelters and communities in East Tennessee. And then from the human side, Dr. French, after completing his undergraduate work in the hometown here at Knoxville at the University of Tennessee, then went into a medical degree at ETSU. Quickly becoming rooted in the beautiful surroundings of the Tri-Cities, Dr. French completed his residency training in Bristol. He had the privilege of caring for patients at 2 hospitals and physician-owned groups. He's now back here in Knoxville and enjoys learning the stories of the families that he cares for and being an integral part of their physical, spiritual, and emotional health. Thank you both for joining us, and we will turn it over to Dr. Becky to get us started.
Hey, thank you. Thanks, Candace and T, so much. Perfect. All right. Well, thank you everyone for being here. I'm really excited to be here with you. And let's see, the slides are jumping around. Okay, got it. Like Candace said, I work here at the College of Vet Medicine, and I'm going to run through as quickly as possible some of the first aid that you might need for the pets that you're serving. It sounds like most of you either work at a shelter, volunteer at a shelter, or maybe are animal control or somewhere in that field. So it's going to be fast and furious, but hopefully it won't be too overwhelming. So just a quick look, we'll go over unresponsive animals, trouble breathing, heat stroke, seizure, broken bones, shock, and hit by cars. And this might be info a lot of you already know, but I just want to start from the fundamentals. So I just want you to have in mind the normal heart rates, respiration rates, and temperatures for most of the animals that you're going to be dealing with. You can see here that cats and small dogs both have higher heart rates than large dogs, and that's just how it works. The smaller animals have faster ones. So for a cat, when it comes to see me, by the time it gets here from a shelter, its heart rate is often around 200, and that's okay. So probably the same situation for you guys, but I want you to have these baselines as just a touching point. And then the same with the breathing rates, those are going to be higher, probably close to 50 when you see them sometimes. And that's fine as long as they aren't actually having trouble breathing and they're in a stressful situation. If it's 50 and they're just sitting in their room or kennel at the shelter, that's probably a different deal. For those who haven't tried counting a heart rate or a breathing rate before, if you set a timer or watch your watch for 6 seconds, count how many beats there are, and then just add a 0 to that. That's going to give you roughly the heartbeats or breathing breaths per minute. So if I watched for 6 seconds and I heard 7 beats, I add a 0, that's 70 beats per minute. And then this is another baseline that I really want you to become familiar with if you aren't already. Check your own animals, get used to looking at the normals. So anything on here other than that normal one needs to go to an ER. They're in critical condition. And you can also check on your own animals if you push. I don't have a good slide for it, but we talk about the refill time for their mucous membrane. So if you push your finger on to pink gum, it's going to get white for, it should be 1 to 2 seconds at most. And if it's longer than that, then there's a problem. If it's way faster and their gums are really red, then that's another problem. So when to take them to the ER, if they're struggling to breathe, their gums are any of those other colors that you saw, the temperature is below 98 degrees, if they're neurological at all, having seizures, paralyzed, really wobbly to walk or walking in circles, if they've had trauma, and especially if you see blood or wounds on the head that indicate that they had head trauma, that's going to need really immediate attention. And it'll get worse if it's not treated right now. So take those guys in, obviously large wounds and chest wounds. And chest wounds, especially, I think of dogs that have been in a fight. If there's a puncture wound on their chest, you might not be able to tell at the moment, but it might actually communicate with their full thoracic cavity. So, so I would recommend getting those in. Obviously, extreme lethargy, a known toxin, or bruising or spots of bruising, and I'll show that in a second. So, an unresponsive pet, obviously, start heading to the vet, an ER, whatever time it is. You can start checking for that heart rate. So, you can see here on this cat where they're holding their fingers sort of at the base of the ribs, right where the elbow comes up onto the ribs a little bit. Get used to that spot on your own animals so that you can check it easily if you're in an emergency situation, and then check a rectal temperature and record it every 10 minutes. Again, those mucous membranes, just the gum color and the refill time, and then check for responsiveness. If they don't seem like they're responsive, go ahead and clap. If they sort of look towards you, then they do hear you and they're responsive to some degree. If they don't respond at all, then we're looking more at a comatose animal and we're in a whole other plane. But another reflex you can check is like this finger indicating here on the dog. If you tap right, just gently tap at the corner, inside corner of the eye, they should blink at least slightly. So if they don't have that reflex, then they're in even worse shape. Warming them, I wanted to touch on this because it's so important. It is so tempting. I've been there. To want to warm an animal that's less than 98 degrees or even less than 99, to want to put them on a heating pad, especially a big dog, you want it on the heating pad, and that putting it on any type of heating element, even the little heating discs that you can do, rice socks in a microwave, all of those can really burn the animals before we have any sense that it's happening. And they cause terrible burns. So, as tempting as it is, even if they're really cold, you don't want to do more harm. So, don't have any of those items touching them. Have at least one layer of towel between them, and then change the position of that item against them every 5 minutes to avoid a burn, and never lay them on it. Your best bet is going to be to have a heater, preferably even one blowing some warm air right at them. And you can even use a hair dryer. So those are some other options, but be really careful with the warming. Trouble breathing, obviously start going to the vet, check the membrane colors. They might be a little bluish because they're not getting oxygen. And I wanted to post this picture. It's a fuzzy picture and not great, but this is actually a specific stance that dogs and cats will take when they're trying to breathe. And they aren't always gasping. So you might not recognize it without seeing this picture, that's what they're doing. This is possibly a dog in congestive heart failure, can't breathe. So they won't lay down. They're sitting up and really extending their neck and trying to breathe that way. So these animals, you really want to keep them as calm and as cool as possible on your way to the vet. And I say that because I don't want them in the back of an ACO truck. I don't want them trying to slip, starting to slip around on a slippery surface while you're driving. They really need to be up in the cab with you in front of the AC unit, even in the winter, to keep them cool because their body temperature is gonna go up. If you have a clinic in there, and even if there's not a vet, maybe they can walk you through how to at least put oxygen on them before you have to travel and give them a little break that way. And heat stroke, unfortunately, we're getting into that season and we've all seen that. So, any animal's temperature, by the time it's getting to 105 degrees, at 105, I would definitely start active cooling. At 107, you're in dangerous territory. At 109 degrees, you're in brain damage and tissue damage territory. 107, you're on the verge. So some of the symptoms, you've probably unfortunately already seen it, but really bright red eyes, ears, gums, and lips. And this I just want to mention, I'll see this on pitties, are the ones I think of who get really excited and they're breathing really hard and they aren't in heat stroke yet. But those are ones that I'm still watching. When I start to see those symptoms, even in just an excited pity, I'm going to try to get them to calm down some and or get to a cooler spot, and not keep revving them up. But thick saliva, vomiting, and diarrhea, you'll see with heat stroke. And then, as you probably already know, heat stroke leads to shock, clotting problems, brain damage, and then sloughing their GI too. And so, who all gets heat stroke? And I just want to touch on this for a minute because I think we all know that these short faced, squishy faced dogs get heat stroke. Same with cats, honestly. And obese animals get heat stroke a lot faster too. But I wanted to mention these guys, these labs, like this black lab here. It's a typical condition in older labs, and it can happen in other dogs. Um, but they develop a weakening in the muscles in the back of their throat that open the windpipe. So that's why I posted these pictures here. So this is a dog whose muscles are paralyzed and they've closed shut. So this dog can be trying to breathe, but there's no opening for the air to go. This is one after a surgery to tack it back, and the windpipe is open. And this is really common. Suspect y'all have seen, especially an older lab that just breathes, and it's not even necessarily struggling all the time. It's a gradual process. They have a really loud, we call it a stridor, and it worsens over time. These guys are at risk for heat stroke, to develop heat stroke quickly, and should never be housed in outside runs, and should really be kept calm in these months coming up. And then even though they aren't squishy faces per se, I think of pitties with some of their shorter noses, and especially the jowly ones or overweight ones, they're going to have a lot of tissue back in that same area by the windpipe, like you see on the top picture. They're going to have a lot of tissue back there. And so they aren't going to have as clear of openings for their windpipe. So they're going to overheat faster too. So keep an eye on those guys. For treatment, this may go contrary to what some of you have already done, but the recommendations these days are to wet them with warm water, not ice cold water. Do not just dunk them into ice or really cold water, and then place them in front of a fan or an AC unit. Check their temperature every couple minutes and write it down so that you can really keep track of the time and the temperature. And then at 103, start drying them off and cover them up, because that temp's going to keep coming down. Never cover them with a wet towel to cool them down. That isn't going to do what you're trying to achieve with it. It's going to trap heat. And then don't put ice packs straight on their skin because that's going to cause problems. You know, we're getting close on time. Hopefully we'll make it. So stop cooling at 103 degrees. And then I bring up these pictures. Hopefully you can see them kind of. So you don't have to remember these words, but gums that have these tiny little red spots of blood on them. It's not quite as obvious here, but they're pointing to them. You might see these on the belly and stuff too. But all of this can happen after heat stroke or other clotting issues. So these are a different type, but it looks like bruising, but multiple spots like that. This means that they're having a bleeding problem. They need to get to a vet right away. So it might not be as obvious to you. So I wanted to show you pictures of that. Seizures, the symptoms, probably a lot of you have seen them. The key to a seizure is that they're not responsive. So if you see a stiff animal and you clap your hands and they look at you, then they aren't in a full seizure. The same with tremors. They could have tremors from toxins or something like that. If they're responsive to you, it's not a seizure. They often pee or poop in a seizure, sometimes vomit. But then for monitoring them, you really want to try to start watching the time. It's hard. It's not what the first thing you think of. But at the 3 minute mark into a seizure, you want to start loading up to get to a vet because by the 5 minute mark, their temp's going to be going up and you can be getting into some of that more into that heat stroke kind of issue. And then start cooling them again, put them in the cab in front of an AC unit with you on your way to the vet. Fractures, I think you guys have all seen these, and I can't tell you which ones have to go to the vet right away because they vary so much. You know, the ones that have, basically come hopping up to you with a broken leg that they've been dealing with. Those don't have to go right away if you can't get them. They're dealing. If it's a recent hit by car, you don't know what all else is broken. You don't know if they're stable or not. I would start going to the vet. But the key with these fractures is don't try to splint them or start bandaging them. It'll actually be more painful. Counterintuitive, that's a longer story for another day. If it's not done correctly, then the splint or bandage can hurt them more. And then I have seen splints and bandages go awry and end up having to amputate legs just because of the way the bandage was done. So they'll be okay if it's just a broken limb or something. As horrible as it looks to us, you're probably better letting them just lie there on a comfy spot instead of trying to wrap it. Same with wounds. Don't try to wrap them. Please don't put hydrogen peroxide on them to clean them. Just at most use water. Don't use alcohol. Try to get them to a vet if it's a wound that needs treatment. Get an e-collar on it to protect it. If you have to put something on it for your own sake, you could use like these Telfa pads and just put tape around it, around the Telfa. Don't start taping around legs and tails and stuff because that's where we can get into some nasty problems. And then a hit by car, these two, right? You guys have already seen these. Some do pretty well, and then some are critical from the very instant it happens. So it's hard to say which ones have to go. The best I can tell you is to check those gum colors, check the vitals, check the vital signs you've just learned. Keep track of those on a piece of paper, the time and the numbers. Gum color, if they're really pale, if they start to get really bright red gums, then they might be going into another stage of shock and having other issues. Feel the temperature of their feet and legs. If those are cool, then they're having problems circulating down to their feet and legs, and that's an emergency. If you can't go to the vet right away, though, keep them warm, calm, which is hard in a shelter sometimes, but as quiet a space as possible, and then really watch them every 15 minutes for all those vital signs. And then for toxins, the best thing I can tell you is to call one of these numbers. It's going to be, I think it's an $89 charge. You'll have to have a credit card that you can give them. But even if you go to an ER, they're often going to have you call one of these poison centers and start the process with them. So you can call, set up the case with them, and then they can tell you if you have to go to an ER or not. And then if you do have to go to an ER, then the poison control center's vet will communicate directly with the vet at the ER and direct the treatment so that the pet gets the best treatment possible. So you may be able to save your trip to a vet and save the cost of a vet by paying the $90 to start the case with one of these two centers. And then I think I got it around the 20-minute mark. Hopefully that you're able to catch some of that as we went through quickly. But I think we'll be available to answer questions at the end. And there's my email if you have additional questions later. Thanks so much, guys.
Thank you, Dr. Becky. We are going to transition over now to Dr. French to tell us a little bit more about the human medicine side.
All right. Can y'all hear me okay? I, I don't think I'm able to click through this. So T, I think you'll have to drive for me. Um, but as Candace said, Dr. Blackwell invited me to come and speak on this webinar about first aid in human medicine, some things that you hopefully won't, but might encounter if you're volunteering or working in a shelter or maybe just out in the community. One of the things I wanted to talk on was just slips and falls. T, if you go back a slide, sorry.
While T's getting that brought up, I do want to share one of the questions was asking if you'd be able to get a recording of the webinars at the end. We will be sharing the webinars on our One Health forum. So if you aren't able to join now, you'll be able to go through it later as well.
All right. So just talking a little bit about slips and falls, some of the potential causes, of course. If you're working in a shelter, I'm sure there's always wet floors around bathing areas. You have to worry about clutter or leashes in the walkways. Of course, steps and stairs can present a problem. There may be some uneven terrain or gravel if you're outside walking. And then, of course, dogs are and pets are a little bit unpredictable sometimes, and they might just take off suddenly and catch you a little off balance. One thing I did want to mention, since they've got that picture of that retractable leash on there, a lot of those things can be pretty dangerous, especially the thinner wire type ones. Sometimes we'll see some amputation of fingers, degloving injuries, which I'm glad we don't have a picture of because those can be pretty gnarly. So just be careful with those retractable leashes, or maybe just try to use the old style leashes. They're much safer. T next. So just a couple of specific types of injuries that can occur with a fall. One thing to we look at and see often is what's called a fouche injury with the wrist. It stands for fall on an outstretched hand. Those are particularly bad because there's a carpal bone called the scaphoid bone that doesn't have a very good blood supply, and it can look okay on an initial x-ray, but you always want to check that x-ray a couple weeks later to make sure that scaphoid bone is okay. Of course, hip fractures are a risk, especially those older than 50. Might be some osteoporosis and some weakening of the bones as we age. Um, Likely to see and experience some ankle sprains sometimes. And then head injury and concussions are big ones, and we'll talk more about that in a minute. Next, T. So one thing I wanted to point out, especially when you come upon a trauma or an injury, is look around and just assess the environment. You don't want a victim situation. You don't want the rescuer to become the victim. Just an example of that in a car wreck, if there's fuel leaking out and the car's on fire, you don't want to put yourself in danger trying to be a hero. So just make sure the situation is safe before you intervene. You always want to check for head impact. You want to assess any deformity or swelling in bones and joints. You want to make sure that they're able to bear weight, especially with ankle and knee injuries and hip injuries. You want to look for confusion or loss of consciousness or just severe pain. And you always want to ask them if they're on any blood thinners like Coumadin or Eliquis or Xarelto. Next, T. So just some basic treatment for more of the minor injuries. Of course, RICE, which stands for rest, ice, compression, and elevation. That's going to be your main treatment for sprains. Just continue to ice in 15 to 20-minute intervals. This can help with pain and inflammation. You can wear these over-the-counter splints or supports to help joints. Just be careful wearing them too long because a lot of times you can develop some stiffness pretty quickly and loss of function. And then just really want to restrict activity for 24 to 48 hours. A little cliche, but just listen to your body, of course. Next, T. When to call EMS? Obviously, if there's a suspected fracture, they need to be seen and x-rayed and evaluated. May require surgical pinning or reduction of the fracture. Um, Also, if there's severe hip pain, a hip fracture is going to sometimes looks obvious. You'll see a leg length discrepancy, so the injured leg will be shorter and it may be externally rotated. Speaking specifically on head injuries again, so if there's headache or confusion, vomiting, loss of consciousness, if they're over 65 or they're on blood thinners, those patients just need to go to the emergency room. They really need a CT scan to rule out any intracerebral hemorrhaging or bleeding. Next. So next I want to talk about different bites that might occur. So especially dog bites, you want to wash the wound for 15 minutes minimum, which sounds like a really long time, but 15 minutes with soap and running water, irrigate it as thoroughly as possible. You want to control the bleeding and apply a sterile dressing. And one thing about controlling bleeding and sterile dressings is you don't want to just keep pulling the dressing off to look and see if the wound is still bleeding. You want to layer those dressings on there because every time you pull that bandage off, you're just pulling the clot off with it, and that bleeding is going to continue. And then if it's not something that needs sutured or needs to go to the ER, obviously put some antibiotic ointment on there like Neosporin. Um, Rule of thumb with dog bites, they really should not be sutured closed. There's just a very high infection risk when you close the wound. Of course, the reason to close the wound is to control bleeding or improve outcome as far as scarring, but you don't want to just seal those microbes in there. Facial wounds may be an exception, again, because you're trying to minimize that scar and the long-term cosmetic effects. Um, Hand wounds from bites are especially high risk because you've got all these small joints and tendons. These infections, these microbes can follow those tendons and tissue planes and really cause a nasty wound. Next. So some of the common organisms you'll see with dog bites, Pasteurella, staph, strep, and Capnocytophaga, which I don't know how I just pronounced that off the cuff, but you want to watch for redness, swelling, and fever, especially like red streaking coming from the wound. We'll almost always use early antibiotics. Usually the benefits outweigh the risks there. So I wanted to talk a little bit about rabies, and I think we might come back to cat bites. Sorry, I got a little out of order there, but rabies, again, you want to wash the wound immediately and 15 minutes minimum. Apparently, that can reduce the transmission of rabies by somewhere between 50 and 80%. You want to identify the animal's vaccination status if possible. Obviously, you're not going to be able to do that if it's a bat or a skunk or a raccoon. In this country, we don't have to worry too much about rabies in our domestic animals, cats and dogs. It's usually going to be, again, the wild animals, the skunks, raccoons, maybe foxes. You want to contact the health department. They've got specific protocols for how to deal with these situations. Generally, if you can observe the animal for 10 days, that's the best case scenario to see if they start exhibiting any symptoms. But you really need to be evaluated for post-exposure prophylaxis. Next. So post-exposure prophylaxis, that means after a bite has occurred, and you don't know the vaccination status, or the observed animal starts to exhibit symptoms, or you can't observe that animal. You would receive the immune globulin and the rabies vaccine on day 0, 3, 7, and 14. You really don't want to delay evaluation though, because unfortunately rabies is pretty well considered fatal as soon as symptoms appear. Next. So initial symptoms of rabies, fever, headache, and just general malaise, discomfort, some pain, itching, or numbness or tingling at the site. And then it starts moving into these acute neurologic phases like anxiety or symptoms, sorry, anxiety, agitation, confusion, hallucinations. You can see some hyperactivity, insomnia. You get this strange effect where the patient becomes fearful of water due to painful throat spasms and fear of air drafts. And then, of course, the classic foaming at the mouth. With wounds, especially puncture wounds and bites, you definitely want to make sure that you're up to date on your tetanus booster. Generally, it's recommended every 10 years. It's pretty hard to find just the tetanus vaccine. You're usually going to end up getting the Tdap, which also has pertussis in it, but that's fine. If it's a particularly dirty wound, which I would consider an animal bite to be pretty dirty, you would want to get a tetanus if it's been less than 5 years, or sorry, more than 5 years since your last vaccination. Next. Back to bites again, we'll talk about cats. Much higher infection rate than dogs. And again, we talked about how the hand bites are most dangerous due to those tissue planes, small joints, and tendons that the microbes can track along. Again, I can't overemphasize washing the wound for 15 minutes and that deep irrigation. You don't want to suture these closed. And again, we're going to use antibiotics for cat bites as well. Here are some of the organisms that you might have to worry about. Pasteurella multicida can cause some rapid swelling and pain, which can also lead to abscess or that tenosynovitis, where you get that infection of the tendon sheath. Next. Bartonella Hensley, cat scratch fever, is transmitted by cat bites or scratches. It can last 2 to 3, sometimes even 4 months. You just develop these swollen, painful lymph nodes in the axillary area, the neck, the groin. Zithromycin may shorten the course of it, but generally it's just got to kind of run its course. So now I'll talk a little bit about some of the zoonotic illnesses, diseases that can be contracted by some of the animals you may encounter. This may be through saliva, fecal oral contact, or urine. There's a higher risk in shelters. You might recognize this one. It's ringworm. You see the circular rash, the raised edges, centralized clearing. It's usually itchy and scaly, a common pathogen present on kittens. Treatment is usually pretty simple. Usually responds pretty well to topical antifungals like clotrimazole for 2 to 4 weeks. You want to overtreat these. Treat it until the rash resolves, plus a couple of days. Just keep the area clean and dry. Wash the clothing that you were wearing in very hot soapy water. Next. Next, we'll talk about tick exposures. So if you do find a tick, you always want to remove it while also trying to remove the head. Want to use some fine tipped tweezers with a steady upward pull. Clean the area. So indications for antibiotics. This is really kind of specific to Lyme disease, but which comes from the black-legged or deer tick. So you have to have one of these indications, either a black-legged deer tick has to be highly endemic area, which is not really Tennessee. We see maybe 20 to 30 cases of Lyme disease annually, and the tick has to be attached greater than 36 hours. So Lyme disease, you see this typical bullseye rash, again, red on the perimeter, and then that central redness. We treat that with early doxycycline, but again, not very endemic to Tennessee. I forgot to include a slide on ehrlichiosis, but that's what you're going to see more commonly. Um, it comes from the Lone Star tick and presents with sort of fatigue, malaise, fever, headache. Um, but we also would treat that with antibiotics. Next. Here's the Lyme disease stages. So you get this early localized stage, which is the bullseye erythema migrans rash, and then early disseminated stage after weeks to months after the bite. Um, you can get smaller rashes over the body, severe headaches, and then some facial nerve palsies. And then it can affect also the heart, causing palpitations or irregular heartbeat. And then stage three, the late disseminated stage, which is months or years after the bite. Then you can see chronic Lyme arthritis, which presents as severe joint pain and swelling, particularly the knees, and then can also lead to cognitive impairment, shooting pains, numbness, tingling in the hands or feet, and severe fatigue. Here's again the Lyme disease stages. So everything from sort of flu-like symptoms, and then stage two, you get neurologic and cardiac symptoms, and then stage three, more arthritis and chronic fatigue. Rocky Mountain spotted fever, we do have this in Tennessee. So it presents with, again, fever, headache, and then a classic rash, which is centripetal. So it starts in the feet and hands and then works centrally. It's transmitted by the American dog tick. We also treat that with early doxycycline. Alpha gal, you've probably heard about this more in the media lately. It's an allergy to red meat or mammalian, it's not protein, it's actually mammalian sugar, galactose A13 galactose. But it can range anywhere from just like nausea and stomach pain and diarrhea to actually an angioedema with swelling of the lips and tongue and trouble breathing. Um, Usually presents like 3 to 8 hours after the exposure to the mammalian sugar, which is in the mammalian protein. So it's a little bit later reaction than we typically see with an allergen. We'll move on to heat exhaustion. So there's a difference between heat exhaustion and heat stroke. Heat exhaustion is usually sweating, dizziness, nausea, and weakness. Where heat stroke, then you move into more neurologic symptoms like confusion and collapse, temperature greater than 104 degrees. This picture kind of goes to the differences. So again, heat exhaustion, maybe feel faint or dizzy or you're sweating excessively. The skin is cool and clammy, maybe some nausea, rapid weak pulse. Whereas heat stroke, throbbing headache, sweating stops and body temperature rises above 103, and the skin at that point is going to be red hot and dry because, again, no more sweating. So treatment is different for exhaustion. You just want to get to a cooler place, drink water, get hydrated, maybe take a cool shower. Heat stroke is definitely an emergency. You want to call 911, get to the ER. Um, Contrary to what Becky was saying with animals, apparently immersion therapy is still the gold standard for humans. There were some earlier concerns that cooling the skin may tell the hypothalamus to actually increase body temperature, making the situation worse and also cause vasoconstriction. But apparently that's not well founded, and we do still recommend ice immersion. And this slide is actually incorrect. I need to change it, but that's all. If you have any questions, feel free to email me. Email's there, jasonfrenchmd@gmail.com.
Thank you both very much. We'll open it up for questions. But one of the things that I want to bring up is whenever you talk about tetanus, we've all been there and heard the 10 years. But from what I've been told in the past, it's 10 years without incident. And you said the 5 years. And I know one of the common things that happened to me, at least in a shelter environment or in animal welfare, is I was always leave the cage door open and then run into the latch. And there's only so many times you can do that before you probably need to go get updated on your tetanus.
Yeah, yeah. But you're right. I mean, generally 10 years just to stay up to date. But if you have a dirty, obvious puncture wound, then yeah, 5 years.
Yeah, so we have a little bit of time left. So for Dr. Jason and Dr. Becky, if there's one tip, and I know this is putting you on the spot, that you think is probably one of the most important things to be aware of, or that you've experienced a lot in this area, what's one thing that you would want our participants to kind of take away? I know, as you said, alpha-gal has been really big in the news lately, and Dr. Becky and I were talking about that earlier, of just the people we know that have these symptoms. So what can we do on our side as well to prevent that, either through medications for pets, preventatives, for ourselves? What is kind of your recommendation in those areas?
Becky, if you want to take that first. I think Becky's muted. There we go.
Yeah, so I think, as far as prevention goes, especially for us in a shelter setting, our biggest exposure is going to be some cats with fleas, which have different diseases. But for the ticks, I mean, shoot, I remember all the dogs coming in who just had big engorged ticks and ticks falling off and walking across the floor. So, for the shelter animals, we really want to have them give them flea and tick prevention at intake. I know they aren't cheap products, especially to get some of the good ones that work really well and really consistently. But that should be a high priority for the shelter for the animals' sake and also for the staff's sake.
And then once you have been bitten, because it's gonna happen,
Hmm.
Dr. French, what is your recommendation? Because I think there's a lot of information out there on how to properly clean a tick bite, what to do and what not to do.
Yeah, so for ticks, you really want to make sure, like I said, you get the head with some tweezers, um, because leaving the head behind can obviously lead to other infections like staph and strep and things like that are already on your skin. But yeah, just clean the wound. I mean, 15 minutes soap and water. Just make sure you get that wound really good and clean. And like I said, not every tick bite needs antibiotics. But I will say, if you make it to our clinic and you come in with a tick bite or a rash, we're more than likely going to put you on antibiotics because, again, I think the risk of antibiotics is pretty low compared to the potential risks of tick-borne illness.
Yeah, and I just thought of one other thing, Candace. Don't do what I did for many years. Put on gloves or preferably have those tweezers when you're taking that tick off of an animal. Have I taken them off with bare hands? Yes, I highly don't recommend that. So,
Dr. Becky, this question is for you. Um, can you talk a little bit about pets in cars? Is there any situation where it is safe conditions to leave a pet in the car for any amount of time if you're just stepping into a store?
I mean, really, no, because as somebody else pointed out to me one time, and I hadn't even thought of this. Like, if something happens to you while you're in that store, you think you're just stepping in for 2 minutes. But if you fall or something happens, then your pet's still sitting in the car. So, I have been known to look at animals in a car and see that they aren't in distress at that time. So I'll just hang out there for a while to keep an eye on them and make sure the people come back out in a short bit of time, and that animal's going to be safe because, as you know, animal control officers have a whole lot going on, so they can't come to every animal, especially if it's not in distress. But so that's a tactic that I take with some of those. And then depending on the situation, I'll mention it to the people if I feel that that's safe for me to do. But basically I'd say I'd say no.
So I want to follow that up with another question. As we get to warmer weather, we see a lot of pets in cars. And something I never realized is I have a Forerunner, so that back window rolls down, and I thought it was great for the pets, but then was advised later on by a veterinarian that that could actually be dangerous because if you're sitting in traffic, the exhaust fumes and things of that from the pet. Or, can you talk a little bit about safety for pets in cars with them hanging out the windows? How far should they be allowed? How far should your window be rolled down?
Yes, I do have feelings about this. Thanks for asking. Um, um, so have I had my labs and golden retrievers who love to stick their heads out the window, and I think it's adorable to watch them in my mirror. I do, and it actually used to like bring me joy to watch them because they looked joyful until I had always heard the stories. And I still did it. So I'm human like the rest of everyone out there. But I had my dogs in the back seat, had the windows down just a little bit. I didn't notice that Scooter had propped herself up onto the armrest and had lowered the window the rest of the way. And I took a curve. Fortunately, I was on a back road, and amazingly, there was no one coming. And I wasn't going crazy fast that time. And I didn't really, something seemed weird, but all I saw, I looked in my rearview mirror and I saw fur coming up from the ground. And it took me a few seconds to realize that Scooter had just fallen out of my window and rolled off the embankment. She ended up being fine. She had a little scuff, but she and I were both extremely freaked out. And if there had been another car coming when that happened, she would not have been okay. So now, and I have heard the stories from ER vets of dogs with their heads out the window, and you pass an object or somebody passes you too close, and terrible, terrible head injuries. So now when I see those heads and the dog looking joyful, I cringe and wish that I could reach out to the people and share that story. And I should say, Candace, going back to the dogs and cars, I mean, yeah, I agree. Like when it's cold outside, my blanket answer is no, it's never okay. But when it's cold outside and it's not going to be warming up, a lot of dogs are going to be okay in that situation. Not a super skinny, not a, there are so many, there's such a range in there of who's going to be okay and who's not. But I'm going to worry a lot less about an animal in a cold car, even for an hour or something, than I am. I mean, we all know that an animal in a hot car for an hour is gone. So
Thank you. So going back to something that Dr. Branch mentioned about retractable leashes, I think that's a pain point for a lot of people. And I really appreciate you bringing up because I never thought about, we think about tripping hazards or the pet getting away and there being hazards there, but not necessarily getting wound up in them and causing the injuries that you mentioned. So is there anything else that you all would like to say about retractable leashes or the dangers, or any tips for those types of situations?
Yeah, Dr. DeBolt, I was curious about what your take on that was. I didn't even know it was a thing until my sister, who is a veterinarian, told me about the risk. So she had seen more human injuries than I had about with those retractable leashes.
interesting. Yeah, I haven't, and had never thought about the human side of it, honestly.
Mhm.
Back in my day, I had a retractable leash too. Like, I get it. There is the convenience of it. But yeah, for a training tool, it's really useless and confusing to the animal because suddenly they're like jerked back. If they just have a consistent length of leash that they're working on, you can work with them on that that length, and you have a lot more control over them that way. And then yeah, the tripping hazard is a real a real thing for sure. So, and it doesn't take any time for a retractable leash to get too long and they're going after another dog and get up to the dog when you don't expect it and all of that. So retractable leashes are not looked upon super favorably by most of us.
Mhm.
So even with a regular leash, you can still have a lot of injuries that occur. In our training, we were taught, to never wrap a leash around your arm because of the injuries that could occur to you. And even if you're holding it and the pet or other animal that you're working with jerks, it could cause shoulder injuries, wrist injuries, things of that sort, even up to potential dislocations.
Mhm.
So just always being mindful to use your leash properly. It's especially if you have a big dog or a large animal, it's very tempting to wrap it so that you can have a better hold, but that really is an unsafe practice.
Mhm.
Okay, well, we are coming up on time. So I just want to thank you all again for joining us for this very important webinar and being able to help our animal welfare professionals and friends out there, whether you're a volunteer or just have a pet of your own. We want to thank you all for being here. We are going to do a giveaway at the end of the webinar. So if we contact you with an email that says, hey, you're our winner, please be sure to respond to that email because it really is, it's not spam. You really are a winner. And we want to thank you all for joining us. We will be having webinars each month. Our one in May is on grief and bereavement. So that is open for everyone, and it's looking at if you work with pets, whether it be in human medicine, social work, or a veterinary setting, looking at how grief and loss can affect your patients and the people that you work with, as well as yourself. So we hope that you will join us for that session as well. Dr. Serena Manifold will be leading that session. So we really look forward to those, and please let us know through that One Health forum that T posted earlier if there's other topics that you would like for us to cover. So just with our last couple minutes, if there's any other questions, or Dr. Becky or Dr. French, if there's anything that you would like to add, please feel free to do so.
I don't have anything in particular, but thank you all for what you do. And thanks for having us.
All right. Thank you all, and we hope to see you all next month.
That's good. Thank you.